Assessment of newborn and infant. A newborn, or neonate, is a term used to describe a child from birth until 28 days old. An infant refers to a child between the ages of 28 days and 1 year. Assessment is the first and most critical phase of nursing process. The purpose of nursing health assessment is to collect subjective and objective data to determine a client's overall level of functioning in order to make a professional clinical judgment. There are 4 major steps in health assessment. The first thing that we need to do is to collect subjective data. After we collect subjective data, we collect the objective data. And then we validate the client data. And last but not the least is we document our assessment, because this will be the database for the entire nursing process. Subjective data are sensations or symptoms, feelings, perceptions, desires, preferences, beliefs, ideas, values, and personal information that elicited and verified by the client.
Good morning po. Ako po si Juan Rolando Edison, isang student nurse ng BSN University Philippines, ay magsasagawa ng isang kapanayan sa inyo tungkol kay baby. Maaari po bang may paintulutan nyo kung magtanong ng ilang-ilang bagay? Okay. Maraming salamat po. Sisimulan ko na po ang pagtatanong. Ano po ang pangalan niyo ako?
Actually, pangalan Bandison.
Ilang taon na po kayo?
Bali, 25.
Saan po kayo nakatira?
Manila, San Baliches.
Ay, ano po pangalan ni baby?
Chloe Shane Dison.
Wow! Ano po yung palayan niya?
Chloe.
Ate, kailan niyo po pinanganak si Chloe?
March 8, 2011.
CS po ba ito or normal?
Normal.
Wow! Maaari ko mo bang malaman kung sino yung doktor ng bata?
Si Ate Eden. Pero hindi ko alam yung kapila niya.
Sige po. Kailan po yung huling punta niyo sa kanya?
Walter ba?
Sige, okay lang. Kailan ba? Paano na natin?
March 19?
Saan na malichis din natin? Gusto ko din pong malaman kung ano yung pakiramdam nung ipinagbubuntis niya si Chloe.
Naghirap. Nagdili.
Oo?
Nagsusukaan, naiilaw. Ganon.
Yung gift po bang dumating si Chloe sa inyo? Talagang gift na gift?
Siguro, masasabi kong gift.
Kamusta naman po yung kalusugan niyo nung pinagbubuntis niya siya?
Okay lang, tumaba ako.
Mukhang naparami kayo ng kain May nangyari po bang aksidente sa inyo nung pinagbubuntis niya siya?
Wala naman.
May mga issue po ba kayo, Ate Julie?
Wala.
Okay. Ano po yung mga bakunang natanggap ni Chloe?
Bali, isa pa lang. Yung pagkalabas niya.
Ano yung...
DPT ba yun?
DPT po?
DPT 1?
DPT 1 po. Wala na po bang nangyari pagkatapos ng bakuna? Hindi po ba siya nilagnat?
Wala naman.
Okay po. Maaari ko yun po bang malaman kung may mga naipapasang karamdaman sa pamilya?
Siguro yung high blood lang.
High blood po? Sino po yung may high blood sa pamilya?
Ay hindi, ano pala? Yung asthma.
Ay, asthma.
Bali lang simula sa lolo ko.
Hindi naman po yun yung naging cause ng... Yung lolo niyo po, currently buhay pa po.
Panay na yun yung
dahilan po nung... Anong taon po?
Hindi na matandaan.
Okay po, maraming salamat po, ate.
Objective data are data that are directly observable by the examiner.
the subsequent physical assessment or follow-up physical assessment of Chloe. First off, we'll be assessing the general appearance and behavior of the infant. The infant is stated to be 2 months old and appears to be. The infant appears to be clean, has no unusual body odors, and is dressed appropriately for the current environment. The infant is alert, active, and responds to the subsequent touches of the nurse. The infant appears generally happy with the arms and legs flexed. All of the observed findings appear to state that the infant is normal. Following the assessment of the general appearance, we proceeded to assess the infant's vital signs. We assessed the infant's temperature via the axillary route and found the temperature to range in the normal category. Afterwards, we noted the apical pulse rate for a full minute and got a rate of 140 beats per minute. After noting the apical pulse, we assessed the respiratory rate and condition of the infant and came with a finding of 35 beats per minute with unlabored breath sounds and clear lung sounds. The blood pressure was not evaluated. From the assessed portions of the infant's vital signs, all of our findings point to a normal infant.
We assess for the infant height, weight, and head circumference. All points to a normal finding.
Next off, we assess the infant's skin, hair, and nails. First, we assess for the skin color, odor, and lesions. Our assessment came with the findings of a pale white skin with a pinkish coloration. The infant has no strong odor and is free of any lesions. The skin also appears to be soft, warm, and slightly moist. Later, we palpated for the texture, temperature, moisture, turgor, and edema. We came with a finding that the skin was, as stated earlier, warm and slightly moist. Afterwards, we inspected and palpated the hair. The infant's hair was lustrous, silky, strong, and elastic, with some fine, downy hair covering the infant's body. Finally, we inspected and palpated the nails. We found the nails to be extending over the end of the finger. All in all, the assessment for the skin, hair, and nail of the infant points to a normal finding. Next, we assess the head, neck, and cervical lymph nodes, noting the shape and the symmetry. We found that the head was normally shaped and symmetric. Afterwards, we tested for head control, posture, and the range of motion, and found that the infant was still under involuntary head control. Following the assessment of the head, we proceeded with inspecting and palpating the face. We found the face to be symmetric and the movements were equal bilaterally. The parotid glands were normally sized. After the face, we proceeded with the neck, inspecting and palpating the neck. We found the neck to be short and containing folds. The thyroid gland was difficult to palpate and therefore left off. All in all, the assessment of the head, neck, and cervical lymph nodes of the infant points to another normal finding. Following the assessment of the head, neck, and cervical lymph nodes, we went on to the eyes. We inspected the external eye. We found that the inner canthus were horizontally slant with no epicanthal folds, and that the anner canthus aligns with the tip of the penis. Next, we observed the eyelid placement, swelling, discharge, and for any lesions. We found that the infant was free of any tears. Afterwards, we inspected the sclera and the conjunctiva for the color, discharge, lesions, redness, and lacerations. Our findings were a clear and discharge-free sclera and conjunctiva with no lesions, redness, or lacerations. Next, we observed the iris and the pupils and found the pupils to be equal, round, and reactive to the light. Last, we inspected the eyebrows and the eyelashes and noted that they were symmetric in shape and movement and evenly distributed and curled outward. All of the findings point that the infant was normal. Next, we assessed the mouth, throat, nose, and sinuses. We inspected the nose and sinuses and concluded that the nose was at the midline. The septum was straight and the nars were patent. Another normal finding for the infant. Next, we assessed the breasts. We inspected and palpated the breasts and found the infant to have a symmetric breast, no lesions, discharge, or masses. And as so far, the infant appears to be normal according to our findings.
We inspect the abdomen and note its shape. The abdomen of the infant is prominent in a supine position. After that, we also inspect for the umbilicus. We note the color and discharge. The umbilicus is pink, no discharge, no water, and no redness. All points to our normal findings. After that, we inspect the genitalia of the infant, more specifically, the female genitalia. The labia majora and the labia minora are pink and moist, a normal finding.
We followed that up by assessing the anus and the rectum, and found that the anal opening was indeed open and moist, all pointing to another normal finding for the infant.
We assess the arms, hands, feet, and legs of the infant. We note for the symmetry, shaped, movement of the feet and legs. Feet and legs are symmetric in size, shape, and movement. Extremities are warm. They are full range of motion, no swelling, no redness or tenderness. Muscle size and strength is adequate for the age, a normal finding. We also assess the newborn's cry, responsiveness, and adaptation. The newborn cries are lusty and strong, responds appropriately to stimuli when held in the end-face position, a normal finding.
We would now start with the reflexes. We started with the rooting reflex by placing a pacifier on the infant's lips, and found the infant to root to the pacifier. Followed with the sucking reflex, in which we proceeded to place the pacifier in the infant's mouth, where we noted that sucking was present. Next, we performed palmar grasp reflex and found that the infant was still able to grasp on the fingers with exerted strength. Followed that up with the plantar grasp reflex, where we noted that the infant curled the toes down tightly as we touched the infant's ball foot. Next, we proceeded to the tonic neck reflex, where the infant curled the arms and legs of the side where the infant did not face. Followed with the Moro reflex of the infant, where we clapped and noted that the infant was startled with each clap. Finally, we performed Babinski's reflex, where we stroked the foot of the infant and the infant was responsive, in which the infant would fan the toes. By testing the physical assessment of the infant and testing for the reflexes, we found that the infant was normal in practically all of our findings, and nothing proved to be abnormal.
Yan, sa mata. Kemay. Grabe, tulog. Ayaw niya. Tingnan mo, ang grabe oh. Ayaw. Yan na. Bro. Ayaw.
Ang ganda sa pintuan.
Pintuan. Try mo sa pintuan. Yung pintuan tayo. Ayaw.
Ngayon na lang eh.
Diba? Sige ba?
Kaya naman kayo, sige.
Ayaw.
Bakit nga pag ganyan?
Tulog ang bata, tulog. Knockdown.
Ayun na yun. Pwede na yun.
Oh, yun. 1, 2, 3. Let's do the funk. Let's do the funk.